Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
That's an interesting graphic that Doctor made a mistake I'll never forget. This is one of the mistakes that can happen and happens far too frequently in hospitals. There's a doctor who had a code blue was called, and the doctor worked on the person, intubated the person, and did everything to resuscitate the patient. And after he'd done all of that, he called the physician, and it turned out that this patient had requested not to be resuscitated, not to be intubated, not to have anything done. They died, they wanted to go peacefully. And so this doctor doing the best that he could, and when you have an emergency like that, they don't always have the information about the patient and their desires. And so this then is something that happened to this doctor, but happens more often than you could imagine, because people don't always have their DNR statuses at the time they present in a full code. So the question is, how do you keep this from happening? And so this is one of the things as a patient, you need to let your family members know. So in case anything happens to you, that if you do not want to be resuscitated, that they know in advance. But this is among the mistakes that we make. And as you know, there's been a lot of information that suggests that medical errors are among the leading causes of death in the United States. So, but this is just one of them, and probably something that we need to try to make sure that our family members all are aware of our statuses, so that if something happens to us, they don't resuscitate unnecessarily. Any of you have a DNR that needs to be shared with the rest of the family, so they don't come to resuscitate you or something?
Doctor, I know when I go to doctors, they're always asking me, do I have one? And I have one, but probably is the best just to bring up to do not resuscitate to my doctor and let them make a copy.
Good idea. Good idea.
Okay.
Good idea. Good idea. Any other thoughts or ideas on it? Good to see you, Kevin. Now, this doctor took it very seriously and recognized that it was a mistake that made that should not be repeated. And so it's good to hear any other additional thought that you might have. And of course, this is what you have to do to the family once you find out you've made an egregious error, but the deed has already been done. Any other thoughts or ideas on this?
Dr. Callender, I know you don't need that for general office visits, but for surgeries, especially major surgery, is that a requirement? Do they ever ask for that?
Yes.
Mm-hmm.
Every hospital admission they ask for that.
Right, because I know we
But,
did
you
it.
know, if you go to the emergency room, they may not have it because they
Right.
go out and get you without anybody around, and so they may not have information in the emergency room. But for every hospital admission and for every surgery, yes, they ask that question.
Mhm. Okay.
The other thing,
Okay.
Dr. Callender, is the family meeting.
Yes. Family meetings. Well, if you have a family meeting, then it's clear that it's important that you share that with your family so they can let you know, because we always ask that at family meetings.
I got a comment about the medical errors. It seems that medical malpractice is handled much differently in the United States compared to other countries because our malpractice cases go to juries, and juries most of the time award a lot more than a judge. In other countries, they have caps. They have a lot more caps on malpractice cases, and cases are more likely to be determined by a judge instead of a jury. So it's the higher malpractice premiums paid by United States doctors. I think that uh, that leads to the lack of transparency, the less likely to admit to mistakes, because malpractice insurance can, in some cases, put a doctor out of business.
Lost and lost.
They can put a patient out of business too.
Well, there are some states that have caps, just as you mentioned, and there's some states that do what the other countries do, but there's still too many states that actually do exactly what you said, and that's one of the problems. You stated pretty clearly that is a big problem in the United States, and states where they don't have caption put on it. But you said it exactly as it is. Is that Dr. Ivy?
Yes.
Did you have a comment?
No. Nothing to add.
Well, good to see you though, and
Happy holidays. I'm glad to be here.
yeah. Welcome. Now this next article may seem as a joke, but it probably isn't, because there are 100-year-old doctors who still practice. They're not that many, but would you go to a 100-year-old doctor's question? And this is actually Art Kaplan, who was an ethicist, who raised this question because there are other professions, and other professions, accountants and other professions where after a certain age, and even pastors, some churches, after a certain age, you have to retire. Of course, that's not the case for physicians, and so we talked about this problem, the fact that actually, whenever you lose your skills, that's when you should stop practicing. And if you have your skills at 100 years old and you meet the medical standards, then you should continue to practice. Now, the question is, as a patient, would you go to a 100-year-old doctor? What are your thoughts on the matter?
I guess I would if I had been going to that person for a while. I don't think I would start going to one. I don't know why, but I guess I probably wouldn't just pick a doctor for the first time and realize that he's 100. I probably would pick somebody else. But if I've been going to him for a while, I would continue.
You continue. You continue.
Yes.
Yeah. Other thoughts on the matter?
I agree with Betty. I would be the same way. If I had been going to them and for a while, I would continue. But just the straight off the bat, like I was looking on the internet for ENT, and I wouldn't, I looked at the young ones and everything, they had a picture and everything, but I don't know if I would look at one that was 100 to work on me. I don't know why. I guess I was just built up that way in our society. I don't know.
For me, it depends on what type of shape the 100-year doctor is. If he's in the same shape as Dr. Callender, that would be my preference because that's a doctor that could help me get to 100.
Interesting thought. Any other ideas? Thanks for the compliment.
Yeah, is there any major difference between a private practitioner and a doctor who works in the hospital? Is there any major difference in their salary?
Yeah. The private practitioner usually has a higher salary. I'll let Dr. Ivy also give me an idea about that. But traditionally, they think that the academic doctors are lower salaried than the private practitioners. Dr. Ivy, what are your thoughts?
Well, I think, number one, there are very few 100-year-old doctors who are licensed to practice at that age. In light of the fact that there's continuing medical education required to renew your license and things like that, that would be very uncomfortable or inconvenient for an older doctor. But on the other, in answer to your question, I think it depends on the specialty. If you're a general practice physician, your salary range, well, normally the general practice physicians are not hospital-based, are not university-based as a rule, unless there's a residency program there. But surgeons automatically have to be affiliated with a hospital. So therefore, they have a combined salary, depending on the contract with the hospital, how much you're paid for your services, in addition to what the patient is going to be charged by you. So in that instance, generally speaking, as a private practitioner, you can set your own fees. And depending on what the insurance pays for that particular patient, the carrier determines how much you would be paid, as opposed to working on a salary at the hospital. So your options are higher if you're in private practice and have a, or other than a general practitioner, because the rates for general practice are less than for a specialist in terms of what the insurance companies will pay.
Right.
Does that answer your question?
Okay, yeah, does that answer your question?
Yes, okay, somehow.
Okay, all right.
Yeah.
Thank you.
The point that he first made about there's so few 100-year-old doctors, but to that point, licensed doctors. To that point, I'd say that I wouldn't trust any doctor under 60. They've got to be at least over 60 before I know that they would start caring about me as a 73-year-old man.
Well, that keeps me in the game.
Okay, all right, okay. Okay, now this is not a surprise to us, I guess, but as a consequence of COVID and opioid overdoses, we got a 5% rise in death rate, and U.S. life expectancy has fallen lowest level since 1996. And I think the combination of COVID-19, which is still killing people, and the fentanyl crisis, life expectancy is dropping in the United States which is different from other countries in the world. And of course, we've had the highest death rate from COVID in the world anyway. But we also have the highest death rate from drug overdose as well. So these two factors are causing our life expectancy to drop, while other countries' life expectancies are increasing. And this is a cause of great concern. Of course, we're paying more attention now to the fentanyl explosion, and so much so that you can actually get the antidote for fentanyl and overdoses in any pharmacy by just asking for it, because there's so many people who are dying from opioid overdoses.
I think one additional thing should be added though, Clive. I think that's gunshot wounds in the US are higher than anywhere else in the world. So that adds to the.
Right. Right. We're so much, yeah, our overdose deaths are just as almost, well, even worse than the COVID. So, and the difference is that the opioids are affecting a younger group of people than COVID for the most part.
And
what can we do about it? You know, we keep talking about it, and we talk about every year, and every year the opioid overdose death rate increases. And I read in the newspaper once that I guess last week that they got enough fentanyl that they were able to find and get out of this system that could kill everybody in the United States. So that where's this fentanyl coming from, and what are we doing to try to stop it from being used so plentifully across the country? Any idea?
Does anyone other than Dr. Callender have an idea as to what country has the longest life expectancy?
Sweden.
Anybody else?
Yeah.
It's Japan.
Right.
84.
Yeah, that's interesting.
Well, it's funny that you should mention that, because just looking at life expectancy by race, United States, Asians have the highest life expectancy of 86.3, followed by Hispanics of 82. Whites are at 78.6, blacks are at 75. But, you know, with Japan having the highest life expectancy in the world, and Asians outliving the rest of us by far in the United States, 86.3.
That's amazing, isn't it? Yeah, yeah, yeah. Well, it's interesting, and I think it's amazing that Asians, in spite of coming to the United States, still, and our diet, still are by far the highest life expectancy.
Well, okay, this is anecdotal, but to me, it seems that Asians are more likely to stick to their diet than adopt the standard American diet.
Well, that's true. There's so many factors involved. The Asians don't have the, at least in Japan, you don't have the fast foods until McDonald's has moved into Japan.
Well, I know when I went over there, they did.
And I went over there with President Carter, and the Japanese were very small. It's very rare that you see an obese Japanese person. So their diet plays a key role in their longevity, I do believe.
Yeah, it's true. I agree. Well,
Dr. Callender, you asked also what could we do? I did at one of our family meetings. In fact, the last one, I asked our grandchildren, what do they know about the fentanyl? And then there was one grandchild who was a walking encyclopedia. But then they told us about, I brought up about like Barbara Bush or one of them that said, just say no, does that work? And all the grandchildren say, no, that doesn't work. And then they elaborate, it's a curiosity. And they know it's in candy and other drugs. And but even one of the young ones were talking about how they had friends who had passed and was in their schools that had died from a drug overdose of fentanyl. So, and we were sort of surprised that it happened in middle school and et cetera, not only the high schools. And, you know, we read about it in the newspaper, but for the children to actually know of other children that are around them. So it is really more than what we think. And it's time that, you know, you just bring it out in the open and discuss it and what will work. And for the parents, you know, knowledge and information and talk about it and bring it out into the open is, I think, is one way of helping the younger generation and even the older generation to understand how
Yeah.
this is an epidemic.
Well,
Yeah,
I don't think the kids get fentanyl by choice. They don't know that they're buying fentanyl.
Yeah,
It's
that's
usually
what
mixed
they
with
said.
Percocet and other drugs. So it's in the drug, but the kids are not aware of it, and that's why they
Yeah.
get killed.
They're even adding fentanyl to marijuana.
Yeah.
Wow.
Yeah, and we brought that up too.
Yeah.
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 So it's just like home cooking. It's a whole lot better to grow your own than buy it.
Very good.
Yes. Well, you know, the other thing is that you brought up a good point about the middle schools, but it probably needs to go to the elementary schools as well.
Yeah, but a lot of times it's the packaging of them. You know, I saw an article one day this week about how they make it, the packages look like the regular candies and stuff. And, you know,
Yeah.
kids,
Yeah.
like you said, they think they're getting candy maybe, and they end up with.
No, they don't think they get it.
Mhm.
Well, it's a crisis that we have done as poorly with this as we've done with COVID, except worse. And it seems like the more we talk about it, the worse it gets. So we really need a radical step to be taken to address this. Any other ideas or thoughts? Well, it certainly has spiraled from what we thought was a problem 5 years ago to what it now has become today. There's another article that talks about how much water you should drink, and I think pretty much as the article last week indicates that one size does not necessarily fit all, but drinking water and fluids becomes critical. How much you drink, still, we still think around about 2 liters a day. But as somebody had mentioned, I think Kevin had mentioned, when he notices his urine is dark, you know that you are dehydrated.
Unless it's related to
We should remind you that you can overdrink. You can drink too much water, but most people drink too little water. Go on, Dr. Ivy.
I was saying, when you speak of dark urine, it could be related to liver disease too, other things. So, but when it gets concentrated to the point that you can really smell it, and it changes color, from the almost clear to just a little yellow, that's normal. Then when it gets real dark, orange, I guess it would be time for you to increase your fluid intake, your water intake. Because they used to say that eight glasses a day would be ideal, but that was not considering the fact that you eat food which has water in it. And some people can become over and water intoxicated. So
Yeah.
that's something to be aware of.
And it comes about water. Okay, this is another article on working out on an empty stomach, which suggests that before you go out on your walk or your run, that you, even if you don't have a full-fledged breakfast, but you have something for your body to work on while you're exercising. And most of the research demonstrates that while you're at exercising, your body's breaking down proteins and carbohydrates and everything else, so that it's better to have something for the body to work on as you exercise. And I think that's the meat of this article, that suggesting that you take something to eat before you go out on your morning walk or run or whatever.
Mhm.
John Buchanan, you get something to eat before you go out on your exercises?
I do always, even if it's a pear or a banana, I'll eat something. Usually I either have a bowl of cereal or some fruit.
Okay.
And I don't really walk anymore. I swim now.
Okay. All right.
That's how I got to be overweight.
Okay.
Instead of
Remember the gastrocnemius muscles that Dr. Ivan told us about as the heart below the belly button that keeps us going, so that walking is an exercise that is meritorious. So we still remember your talk, Dr. Ivan.
I'm glad.
Okay, I think that's the essence of that one, is before you go to work out, get something in your stomach.
It says eat something, but it doesn't say eat healthy. So what about potato chips or something like that?
Well, we always want you to eat healthy. Now wouldn't have it any other way.
Always work.
But you
Okay.
know, salt, you don't want a whole lot of salt, and particularly in black
Right.
folk.
That's
So you don't,
Yeah.
potato chips not a good option.
But they taste so good.
Yeah, that's the tragedy.
Yes. Mm.
Can't see the title of this one, John. Go to the top again. I can't see the top. Oh, yeah. This is a good article that talks about complete proteins and the so-called incomplete proteins. They talk about the variety of foods, most of which, and this is one of the few articles that talks about animal proteins, because most articles don't talk about animal proteins. And this article talks about animal proteins as a source of complete proteins. Not indicating that you can't do well with incomplete proteins, but suggesting that fish and actually other animals sources give you complete proteins, which help your muscles grow. And it also, as you scroll down, it talks about the complete protein having 20 total amino acids, and 11 of those of which the body produces on its own, and other than that, it doesn't. And it talks about the complete protein foods, which it lists. And as you look at that list, the complete proteins, you see fish, poultry, eggs, beef, pork, and dairy. Yeah, the bottom three are three items that have not fared too well in our discussions. And then it talks then again about plant-based sources of complete protein. And you see the common ones, some of which you're aware of and some of which you may not be aware of. That Darryl, any comments about these plant-based sources of complete protein?
Yeah, I think that's a bad list from this guy. He didn't do his research.
What would you add to that list of plant-based? He's talking about vegan sources of complete protein.
Yeah. Okay. I'll put it like this. All of the animal sources that he listed, all of those animals, uh, they get their, they get, okay, animals are protein because basically they get their protein source. It starts with plants. Any plant that you eat has protein. Any protein that you get from an animal product is just secondhand protein. It's not as robust. As far as like the list of complete plant-based protein sources, that's about all plants. He's got a limited list. He's got the list of so-called soybean products. They're a little higher in protein content, so he lists that because tempeh, miso, tofu, that's all soybean based. So he's got a kind of a preference to some plants as opposed to others. But like when you get down to that paragraph that says everybody's getting at least double the protein that you need anyway, it's not really an issue.
Any other thoughts about the protein foods, which are very important, whether it's complete or incomplete? We need them because we need our muscle need regeneration. Now, I think that whole grains and beans, I think, he emphasizes, and I think that most of the articles talk about the grains and the beans and nuts.
But I think with meat protein, I think you also get some fat in there, and that makes the food taste a little more tasty, but it also adds unnecessary fat. So your cholesterol tends to rise with the meat protein as opposed to plant protein. So in that sense, you're strictly limiting yourself to the protein rather than a combination of the fat and the protein.
Right. And it's the fat that started the protein fascination because they found out in the 50s and 60s that animal protein made larger muscles, not necessarily stronger muscles, but the fat content produced larger muscles. So the thought was that larger was better and stronger, but not necessarily.
No, but it adds fat to the blood vessels of the heart too, so that's not particularly good. So I think with muscle building, most of them are on steroids, and that sort of adds to it, the muscle size. That's what the bodybuilders use. But I think in consideration of what it does to the heart is more important.
Well, this is an article on the Mayo Clinic diet that compares that with the other diets, and especially diets for weight loss. Some have thought that the Mayo diet is overrated, but scroll down, you'll see that it's a diet that has been studied, but and you can see what they're emphasizing are the same concept that we've talked about: avoid eating added sugar, fruits and vegetables, not too much food or dairy, no alcohol, no eating in front of the television, and no eating out. This seems like Darryl submitted this article, but anyway, good issues that they bring up.
I always.
Most of
eat in
which
front of the TV.
the American public does not agree with. What'd you say, John Buchanan?
I always eat in front of the TV. Always.
TV or computer.
Right.
Okay. Phase 2, let's go to phase 2. It's interesting that you point out that something we talk about all the time is physical activity, which we must do as we age in order to stay healthy.
I got a comment about eating in front of the TV, and it's really nothing to do with the TV, but it's great to have dinner with people, with actual people, like family meals, because you talk, and when you talk, you slow down. You don't eat as fast, and so your body is more likely to say, "I'm full," before you have gorged yourself.
Okay. You know, it's interesting because Americans really have an idea what hunger is because we eat so much. We really know what hunger pains are. Because we think you have to eat 3 times a day, and we have places where they eat really at all. So. This is an interesting article. I didn't realize that Mark Cuban was such a humanitarian. He's been involved in using his funds to try to decrease the enormous costs of medication. And we have talked recently about how expensive insulin has become. And so he's been involved recently in trying to work with reducing the cost of insulin, which, as you know, has come into the fore because many patients are rationing the insulin because they can't afford to pay for insulin any longer. And so among the drugs that he's working on to reduce their costs is the insulin, which is, of course, is a life-saving medication.
I think he's doing what our government fails to do. That is, allow for competitive bidding for the cost of drugs. That's a big problem.
Yeah, I think one of the biggest of the day. As big pharma gets bigger and richer, this impacts negatively on the rest of us. But it's nice to see somebody who's among the others of the very rich who are doing their best to make a difference and share the wealth, which is nice to see. The cost of drugs in the United States is almost embarrassing. And so to see efforts like this is very impressive. You know, you see some of those TV articles in which they show way in which some health plans allow you to using them can reduce the cost of drugs. And Walmart has a list of drugs that you can get far cheaper there than any other place. And so if you're really conscious, you can try to find a way to decrease the cost of the enormous cost of drugs, which are required to stay to treat diseases. Of course, the best treatment is an ounce of prevention, which is worth a pound of cure. And the healthy eating and exercise is the key to that. And the exorbitant price of insulin is something that is horrifying. There was a time when your insurance would pay completely for the cost of insulin. But as the people economize on their insurance plans don't cover the cost of some medications. And then you have some medications whose costs are so prohibitive that in order to survive, people can't afford to take some medications. Have any of you encountered any of these kind of problems with getting medications? Or does your insurance cover that?
No.
Fortunately, we are older.
Recently,
Medicaid.
I had an expensive prescription. But when I went to the pharmacy, he told me the cost. I said, "Ooh, that's a lot." But he did a good card or a good something in the system and drastically reduced it and gave me the card to use for future prescriptions. I can't think of the name. It was Good RD or something like that.
Good, all right.
Yeah.
Yeah. Yeah. And it drastically reduced it. I mean, I didn't do anything. The pharmacist did it.
They have a commercial like that that points out that there are programs like that. Was that Dr. Callender I saw?
Yes.
Welcome.
Thank you. Just listening. Thanks.
And when I see those Good RX commercials on TV while I'm eating my dinner, you know, I always wonder, you know, I take a dim view of that. I mean, how come that can happen? Wouldn't everybody use Good RX to reduce their
Exactly. Yeah.
their medical expenses? You know, it's hard to understand how they can do that.
But they do it. It's interesting. Yeah. Yeah. It does seem unfair. Yeah.
Yeah, it does. Yes.
Okay, let's go to the next one. this is an interesting article on supplements that actually boost heart health, and you read about these supplements that are not new, but old as not as old as Methuselah, but certainly around the antioxidants, the omega-3 fatty acids. Actually, much of this is found in fish, of course. Vegans who don't eat fish may have some comments on that. Darryl, what are your thoughts about the omega-3 fatty acids and the fact that a lot of it is found in fish?
I don't know, but since I don't eat fish, I guess it doesn't apply to me.
Right, that's why I asked you.
Yeah.
I knew it didn't apply to you.
Well, my heart health seems to be pretty good, but check with me in about another 27 years, and if I'm still.
Well, anyway, omega-3 is richly supplied outside of fish, as you know. They have so many omega-3 products that they've been popularizing for at least the last 20 years. And the reason they mention it is because it's supposed to be good for your cholesterol levels, and along with folic acid. So,
Yeah, Dr. Callender, I went to my doctor with all my medications when I switched doctors. I have a doctor that's got trained at Howard University, and he told me to stop taking it. I was taking fish oil, 2 of those fish oil pills every day. He said,
yeah.
he hasn't seen evidence where that really helps. So I don't know. I stopped taking it. I haven't fallen off the cliff yet, but we'll see.
Well, it's interesting. They do research on so many of these things. The antioxidants, of course, well known to be associated with the telomere lengthening, which is what allegedly gives us longevity.
And we always bring up cod liver oil. Remember that? Back as a child.
Okay, let's go to the next.
I'm sorry. Now I have a comment. Because olive oil contains omega-3, and so if you don't want to eat fish oil, take olive oil. And I'm a big olive oil proponent.
Okay.
Me too. Yeah, I like olive oil. I had some this morning.
Well, it's an interesting article about sore throats, which now is the commonest manifestation of the COVID. Sore throat and runny nose now are the two common evidences of COVID. Early, no longer the alteration in the taste of food and the smell of food, but now sore throat. But anyway, this is not talking about the COVID sore throat. This is talking about having a sore throat. And when you have a sore throat, I think it's important that you really find out what is causing the sore throat. There are a number of causes of sore throat, including infection, esophagitis, caused by bacteria, as well as fungi, also associated with taking products that are harmful. Something too hot can damage the esophagus, the tube that conveys food from the mouth to the stomach. But anyway, these are some things that will ease the sore throat. Though you can see thing that you wouldn't be surprised to see warm cereals like oatmeal, grits, or cream of rice, pureed vegetables, yogurt, jello, hummus, scrambled eggs, soup, smoothies, ice cream, puddings, popsicles, and tea. All of those are things that might soothe it. But don't be deceived. You need to find out what's causing the sore throat. So that not only don't be lulled into false sense of security when your throat is sore by just doing these things and forgetting about finding out what causes sore throat in the first place. Because esophagitis, GERDs, esophageal cancer, and other things, as well as infection, can be the reason for sore throat. And so my plea is that if you have a sore throat, you should make sure that it's a benign and not a serious disease entity that requires treatment. Then talks about how else can you treat a sore throat? Well, I think I also talk about things to avoid. As you see this list here, and it points out the things that are not good for you, and I think that's good to keep in mind as well. Every one of those.
Not on the list for food to avoid, dairy. Dairy can, I'm just reading from the internet, dairy can be acidic, so it may irritate your sore throat. Sometimes dairy can thicken mucus, so it's best to avoid cheese and other forms of dairy if your sore throat is due to an upper respiratory infection. But typically, I know we got a lot of singers on the group, and singers will always do better avoiding dairy because it does increase mucus. And so if you want a clear singing tone, it's a good idea to avoid dairy.
Okay.
I see Betty Blaylock's potato chips on that list.
I saw that, John.
Well, anyway, there's a lot of ways you can treat this sore throat, but none of them do I recommend, because I think it's important to really find out what's causing the sore throat. When should you see whenever you have a bad sore throat? I don't agree with this trying to mask it, because I've seen so many patients come in after they've let the sore throat go too long, and some of them have turned out to have esophageal cancer. Now, if you're going to say how long should you wait for a sore throat, I think if you have a sore throat that lasts longer than 3 to 5 days, you need to see a doctor about it. That's my feeling about it. Dementia is a problem that we've recognized, although there's some evidence from some of the articles that it is decreasing over time. Still, it's a problem that affects many above the age of 60. And apparently there are some ultra-processed foods that contribute to them. You see some of the things that you may like, hot dogs, sausages, burgers, French fries, sodas, cookies, candy, all the things you might love. So,
potato chips.
so the ultra processed foods, as we've talked about for quite a while now, play a major role in dementia as well. Of course, we talk about them, but there's many other factors that contribute to it as well. Of course, one of the things that almost every article talks about is the mental gymnastics that you can be involved with, which promote good mental health. Those of you who like to do puzzles and involve yourself with chess and those brain testing items, very important.
You know, like Sudoku.
What did you say?
Sudoku, it's a numbers game,
That's
pretty challenging, especially when you get up to the difficult levels.
okay.
Mm.
The good old American diet, huh?
Mm.
And that's what you see on every commercial. Ultra processed foods. It's
Especially
just
with carbs.
amazing to me that we publicize ultra processed foods more than anything that I see on television. It's the ultra processed foods. We make it so attractive that young people think that it's okay.
You're stepping on Charles Barkley's feet now.
Yeah.
I'm just gonna go down.
You know, there's no wonder that Americans are so overweight because most of our commercials are either alcohol or ultra processed foods. How do you avoid ultra processed foods? Well,
You don't. It's hard.
this is exactly what Darryl has been saying. Prepare your food from scratch. That's right.
Grow
Eat
your
at
own.
home.
Oh, yeah.
Yeah, that's right. Yeah. No,
Well,
suppose you can't cook. I guess learn.
you cooked all your life, then it's time to sit back and relax and not have to cook. That's the way you feel, you know. It's the way I feel anyway, coming up.
Well, I feel you, Betty, because it's unfair that most of cooking responsibility is put on women. That should be shared, where everybody cooks in the family to make it easier for everybody to eat good food.
But that's beginning to happen now, but coming up, bringing up my children, women cook. So
That's right. Yeah.
this stage of the game, I'm tired of cooking.
Most of the young people today don't cook at all.
Yeah, that's true. A lot of them don't.
And what
Well,
they do eat is fast food, or they go out for dinner, whatever.
I try to eat healthy, but I'm looking at all the diets and what to eat and what not to eat. But when I decided I wanted to lose weight, I just cut back on my portions of whatever I ate. Some of it was not healthy, but I just cut back on the portions. And in the last 7 or 8 months, I was 80 something. I've lost about 25 to 30 pounds.
Wow.
Wow.
That will work every time. There's so many diets out, and every diet is trying to make it so that you can still eat everything you want and lose weight. But the best way for any diet to work is to reduce the intake. You can believe that if you don't eat, you will lose weight.
And I still eat all the unhealthy things that I've been eating all my life. Ice cream, potato chips.
Potato chip diet.
Yes, but I eat less of it.
there's another thing you can do. Some of our plates are huge, right?
Yes.
You switch to a smaller plate,
Oh,
like the medium size plate, and just don't put so much on it. And you can, sometimes when I'm eating breakfast with 2 eggs and 3 strips of bacon and 2 sausages, and sometimes when I get halfway through that, I feel, wow, I'm already full. So I can actually stop and put half of that away to eat another time. I've started to notice, more when I get full, and I can stop eating at that point.
Well,
Well,
instead of,
not too long ago, there was a practice of wiring the jaws together. Remember that?
Yeah,
That was very popular, and people would make little slits in the side to slip food in. The only problem was that if you really began to choke and the jaws were wired, it's kind of hard to revive you. So they stopped using that. That was the real extreme to which they went to make you lose weight. And women used to do that. Heavy women, they would do that regularly, but they would find some way to get around that wiring.
and
well,
the other thing is,
another thing
the
to
other
do
thing
is
is-
to not eat after 6 o'clock.
yes.
It's I remember I mentioned this once on a radio program. They almost booted me out of the place, but not eating after 6 o'clock is another good way to do it. As you mentioned, portions is a great way, but also for those who eat at night, stop and try to not eat after 6 o'clock. That's another way of reducing your intake. This is an article on 5 tips to stave off dementia as you age. And it's interesting as as we see all of these key takeaways, they often start with exercise. As you see, that's
Exercise and
number 1.
diet.
Right. and then telling you not to smoke and not to drink.
Yeah.
It's amazing how you're brought up makes a big difference on how long you live and what kind of risky behaviors you indulge in as a child. Kind of, in some ways, determines whether you age or not. And
very true. Very true.
With all my bad eating, I'm glad I was brought up not to smoke or drink. Don't have those problems.
yeah. Physical activity. That's something everybody can do, although the different ways you can be involved in physical activity. Because even if you have arthritis, you can do water exercises. But it is one of the ways that seems to work. Diet, of course, is a necessary one. We've talked about that always. Those are 2 things we always talk about, diet and exercise. Then, of course, the treatment of ensuring that your blood pressure is controlled. We talk about that as well, in terms of taking your blood pressure periodically to make sure that it's at least lower than 140/90, although the recommendation is probably closer to 130/90. And then time and time again, we reminded about smoking. So, it's amazing how they publicize smoking when we were all very young. And so many people are dead today because they took up that habit. or sick. And then, of course, alcohol. And then, of course, while they don't talk about heavy drinking, they certainly have enough alcohol commercials, don't they? Yeah.
Alcohol and fast food. commercial.
Right. And they really try to rush you to an early grave is what they follow. If you look on TV and follow the commercials.
Well, they all look like they're having a good time. They don't play the tape all the way through, though.
Mhm.
Yeah, well, here we are. And I think all of these are good ways to minimize the likelihood of dementia. And of course, they also increase the likelihood of you aging. And of course, as you age, the likelihood of dementia occurs.
You know what they say, the more birthdays you have, the longer you live.
Well, you're leading the group right now, Louis.
Yeah, yeah, I'm way up there.
That's right. 91 and still counting, huh?
91.
Look well.
But I gave her practice.
Okay, all right. Is that, yeah. This is an interesting article about kidney transplantation, uniting high school classmates 2,000 miles apart. The human condition is, we talk so much about the negative, but there's a lot of positive things that happen. And this is a good example of somebody caring. Love, of course, is the greatest gift of all. And this kind of love demonstrated by giving an organ to somebody else is one of the greatest gifts you can have. Christ died and gave his life so that we could have eternal life. And now and one of the things about being a donor is that it helps you much spiritually and as well as physically and mentally, because you perform a heroic deed, but you also have demonstrated love in action. And this is an interesting how these folks from long distance found each other again and gave a gift of life. Kidney, gift of life. Liver, gift of life. We've got examples. John and Tatum has both, kidney and liver. So he typifies the wonderful things that can happen as a consequence of this gift of life, whether it's an organ or tissue, as a matter of fact. And in this case, we're talking about a kidney transplant. What makes a person do it? Well, it's interesting that these people knew each other, but they were also a category of donors called altruistic donors, who don't know anybody else. They just want to give an organ to help somebody, and they don't even know them. So, and it's interesting how some people actually recognize that you have two kidneys, but you only need one, and so they think that that other kidney was given to them to help somebody have a second chance at life. And this then is the category of living donors, whether it's altruistic or is giving it to someone you know and love. And going through tests to make sure that you're healthy is something that is done. Also to make sure that you're a good match, and also that the donor can withstand the rigors of surgery, and also that they can live a normal life after they've given this wonderful gift. And so this is something that
Dr. Callender, I've always had a question about that. Is there any, I don't know, research or documentation about the kidney donors, how their lives have been affected?
Many,
by,
much
the donation
literature
process?
demonstrating that they are able to have children, bear children, and live long lives thereafter. There is also evidence that some kidney donors can lose that one kidney and become recipients themselves. They will just skip the queue and get to the top of the list. But for the most part, donation is done, and there's many articles that have looked at followed up kidney donation for as long as 30 to 40 years. And the impact on health is considered negligible. But this is an area of great concern because we have actually, MOTEV has adopted living donation as one of its themes for the future, because the African American community has become such a poor utilizer of living donation. There was a time when African Americans were among the those who were doing living donation. Right now, we're kind of at the bottom of the list. We've increased deceased donation, but in terms of living donation, we have gone backwards a lot over the last 10 years. But there is data that kidney donation can be done with a negligible impact upon the health of the donor. Any other comments or thoughts about this
Yes,
concept?
with respect to these organ donors, living organ donors, we don't hear too much about like eye donor, living eye donors. We
Well,
have
you don't have any living eye donors. All of the corneal transplants are from people who've died.
okay.
So the living organs that you can give, and the living tissues, of course, blood, as we have John Buchanan, who's given 100 donations already. Of course, blood transfusions, of course, plasma donations. And then, of course,
104.
you can give the part of the liver, you can give the kidney, and you can give part of the lung. And you can give the part of the intestines. Whereas the other organs, for example, the heart is deceased, cornea is deceased, and most of the other tissue donors are deceased. But the live donors can be, as we mentioned, blood, blood and kidneys and liver.
Doc, I just gave my 104th donation last week.
Oh, congratulations. Remarkable story. Any other comments or thoughts about living donation?
I think everybody can remember that our son gave his kidney to my husband as a living donation.
Mark.
Yes.
Yeah, Mark is quite a hero. He would never talk about it. And all the times that we've had him on, I had to drag him out to talk about the wonderful act of donation that he did, giving his father. But one of the things that living donors talk about is the mental and spiritual benefit of being a donor. but you have to be healthy enough to be a donor. This is a shocking article that you actually have people who are unvaccinated who got measles. And this is the new disease that can run rampant if you're not vaccinated. But they did have some children who were vaccinated. And this is a fearful disease because it's very, very contagious. And to see that it's affected people in the United States is shocking because we thought we eliminated the measles from the face of the earth.
And there's so many people who are anti-vaccination of any kind.
Yeah. It's amazing how many people remain that way. Well, I don't know, when we think about it, how can you convince people to be vaccinated if they have had bad experiences?
I thought that was a requirement for going to public school. You had to have your measles and mumps.
Unless you have a religious reason not to. Some may have religious reasons for not doing so. Some may even have medical reasons. But most schools require vaccination, as you pointed out. It's amazing that EMTs are so important, emergency medical technicians who are in the ambulances and play a very important role in being the first responders when people are sick. It's an important role. And many of them have quit because of reason I'm not sure. Of course, the salaries are not huge. And one way of increasing it is increasing the salaries. Because can you imagine not having EMTs on the ambulance? Because they're the first responders and they often put in the tracheal tubes and do all of those things that are necessary to resuscitate people who would otherwise die. And so this is another area that we're having a shortage of doctors, we have a shortage of EMTs, and so this then allows for physician assistants and other professions to grow. So the bottom line is they're going to have to increase the salaries and going to have to try ways to increase because EMTs are an invaluable resource. Most of the many, I'd say a significant number of the medical students that I interview for medical school have been EMTs at one point or another. But many of them have just got into it because they wanted to learn, have the experience of being an EMT. They didn't do it for the money. Any other items?